Welcome all. Welcome to this Excellence ECG details. This is a question coming out with a ECG strip, which is very common nowadays in examinations. The 45-year-old patient presented with fatigue and palpitation. ECG done. What is the first drug will you give in this case? Is it isosorbate dinitrate? Is it aspirin? Is it calcium gluconate? Is it milrinone? So let's see the ECG strip properly. And if you see the ECG strip minutely, you will understand very easily. Here P wave is there, QRS wave seems to be normal, and the most important thing is the T wave. It is a broad-based T wave, and most striking finding is tall and peak T wave. It is seen in cases of hyperkalemia. We are going to keep this particular discussion very concise, as time is very limited to most of the examinees right now, and we are going to mention only the important points in this ECG. Here, this is the striking finding that is seen. This is a tall peak T wave, and other findings are not seen here. But this is the first change that happens in the ECG. And we have to remember hyperkalemia among the electrolyte disturbances is something a physician should be very much concerned with. Why? Because it is going to affect the atria and conducting system both. So in no time, it can, if the potassium level goes up drastically, it can lead to cardiac arrest and death. So we have to understand this is something a physician should be aware of very much. So first they also depress the SA node. They depress the SA node as the level goes up, and then after they disrupt the conducting system. So first thing first, what is the normal level? That is 3.5 to 5 milliequivalent per liter. That is the normal level. There it can be actually classified into three types: mild, moderate and severe. Mild, moderate and severe. Mild is going to be up to 5.5 to 6, 5.5 milliequivalent per liter. Moderate whenever it is crossing the 6, and severe it is going to be up for 7 milliequivalent per liter. Now we already have talked why this particular condition is serious, as it depresses the heart in no time without any alarm as such, because most common presentation in cases of hyperkalemia is asymptomatic. Without any much alarming condition, patient can go into the state of cardiac arrest if we allow this condition to propagate further. Most condition is asymptomatic. This most common presentation is asymptomatic. Now, interesting thing, among the presenting the symptomatic patient, what are the findings that is seen? One is myalgia, another is weakness. These are the common finding, because the potassium is very, very important for heart, neurons and muscles. It is very, very important for heart, neurons and muscles. So we understand by now what are the things that we will see. Most patient are going to be presented as asymptomatic condition, but among the presenting features we have already talked about myalgia and weakness. The condition whenever the potassium level goes up, which actually catches the attention of a physician, is dyspnea and palpitation. Then patient comes, we do the ECG, and then we see this particular sort of finding, and this is actually a moderate finding. It can lead to many other finding in ECG, like prolongation of peer interval, prolongation of peer. It can actually lead to flattening of P waves. It can lead to broad QRS wave, broad QRS, and the most dangerous finding is sine wave pattern. Sine wave pattern. So we till now have talked about the important clinical findings and also talked about the changes that can be seen in cases of hyperkalemia, and also talked about different ECG findings that can be seen. So how to treat this condition, because the condition without no alarm can lead to cardiac arrest, and that can lead to loss of life. As a physician, we should be very much worried of this particular condition. So first thing we have to do, ensure the cardiac stability. What will do that? That is calcium gluconate. We have to give calcium gluconate. This is the answer of this particular question also, calcium gluconate. That is the option number C. Calcium gluconate is the answer. After stabilizing the heart and after giving the calcium gluconate, immediately we are going to see the improvement in the ECG, normalization of the ECG. The T waves are going to come into the normal heights. The second thing that we have to do to put the potassium back into the cell, inside the cell. It is the most common intracellular ion, so it went extracellular, which raises the potassium level in the blood. So we have to bring back the potassium back to the cells. What will do that? The most important drug that will do that with convincing and fastest drug that will put the potassium back inside the cell, that is insulin. It does the work within 15 minutes. This is the fastest acting drug. Next, the other drug is beta agonist like albuterol. Beta agonist like albuterol, which does the trick within 30 minutes. Another drug that we can give, that is sodium bicarbonate. And another thing that we have to do also, the excess potassium that is in the body, we have to remove those, and for that we have to do diuresis first and or exchange via potassium exchange resin. So this is the how we can counter a medical emergency which can result from a condition like hyperkalemia. Hope you like this particular presentation. If you like us and if you have any question regarding this presentation, you can put your question in our pages message boxes in Facebook, and follow us in the Facebook, Twitter and YouTube. And here I should mention two names, Dr. Ankit Saha and Dr. Mithun Saha, who actually helped us from the inception, and I am really thankful to both Ankit and Mithun for their help. Thank you.